COVID-19 pandemic really impacted so many different factors that could influence people with eating disorders. And we found that there were varied benefits and challenges around remote healthcare support. So things like seeing your self-view camera when you're on a video conferencing platform like Zoom or Teams, that can be very unnatural for us. If you're also dealing with body image issues, that can be really distracting and it takes away from the therapeutic relationship. There were things around physical monitoring. So how can the service providers identify if, for example, someone has suddenly lost a lot of weight? That can be really difficult to identify if you're just communicating through a camera. RHED-C stands for Remote Healthcare for Eating Disorders Throughout COVID-19. It's a 3-year project and it's funded by the Medical Research Foundation. And what we're aiming to do is learn from what worked well and what didn't with remote healthcare during the pandemic in order to see what we can improve for future service provision for eating disorders. We've used perhaps more traditional methods like interviews, focus groups and online surveys. But what we were also keen to do is identify ways to engage people who may not otherwise engage with those kinds of research methods. We did some art-based workshops where we could move away from just written and verbal communication and try to find some artistic ways that people could articulate their experiences and their emotions.
I found out more about what they were doing in terms of involving people with lived experience, and I said, would I be able to be involved as well in that capacity? Because I have struggled with eating distress and thought it would be a useful thing to be involved in both aspects, and was really interested, as I always am, in trying to contribute to any research that will have an impact on eating disorder provision. The participants said that they really enjoyed being in the group, doing the activities and having the chance to share their experiences with each other. I feel that Dawn's research is so pioneering as they're developing the toolkit and everything. They're constantly going back to those that hopefully will be using it.
Working alongside individuals with lived experience of eating disorders is really central to what RHED-C stands for. We're aiming to learn from experiences of receiving and giving remote health care during the pandemic, and we can't do that if we don't hear those experiences. There are 3 main outcomes I'd love to see from RHED-C. So the first is greater awareness of the challenges that individuals face when they're living with eating disorders, and that's within the general public, but also to inspire more research in this space as well. The second thing that I would love to see is something around practical resources to help both healthcare service providers and also the individuals accessing their services. Some resources that can help them to get the most out of their online sessions. And again, through RHED-C, we're developing an online toolkit, which we will be launching soon, which is freely available for everyone to use. At the moment, there's no NHS guidance specific to eating disorders and particularly remote treatment, and that's something that we would like to see changing. The majority of our participants and also the healthcare service providers have expressed that online services are actually hugely beneficial and they do want them to remain to be offered in the future. So anything that we can do that can help people access services is going to be hugely beneficial. The foundation funding has really been critical to allowing this research to take place. Without the support from the Medical Research Foundation, I would not have had the time or the resources to do this research. And because research in this area is so traditionally underfunded, it's really critical that we have support like that from the Medical Research Foundation to allow projects like RHED-C to go ahead.